Hello. Today we will be discussing how to maintain balance by reducing medical errors and promoting patient safety in healthcare. Today's healthcare is experiencing turmoil as costs continue to rise and the well-being of patients is jeopardized. Medical errors happen more often than they should. However, by reducing these errors and placing patients at the top of the priority list, healthcare professionals and other staff members can work towards developing a better healthcare delivery system. This all begins with the culture of medicine. As physicians have gone through medical school, they have often found that they are taught one way, and this is the way they continue to practice, regardless of whether or not it is outdated. This needs to change, as patients and providers need to fully understand and respect one another. Reducing errors and promoting patient safety can happen in a variety of ways. In reducing errors, we need to be fully aware of the never event, know that technology does have the capability to fail, and implement checklists. In promoting patient safety, we need to implement team coordination, learn how to effectively communicate with the patient, and know consequences of unaddressed medical errors. The never events were developed by the Centers for Medicaid and Medicare Services as events that will not be reimbursed if they occur. Events of this type include surgery on the wrong body, objects left in the body, air embolism, and pressure ulcers. There are others that are listed as well. We have to remember that technology has the capability to fail. The electronic medical record is a prominent example of this. There are three aspects where EMR can be improved, including computerized physician order entry, clinical decision support systems, and barcoded medication administration. Computerized physician order entry allows errors to be reduced by kicking out any order that is illegible. The clinical decision support systems were designed to help physicians make certain decisions, and the barcoded medication administration was designed to ensure patients are receiving the proper medication that coincides with their needs. These are great, however, the errors that occur with them have to do with nurses and physicians not effectively communicating with each other. Therefore, nurses are not up to date on what is going on with their patient. By using checklists, physicians and other healthcare professionals are able to prepare themselves prior to performing a procedure. This was developed by Dr. Pronovost, as he got the idea from the aviation industry. Promoting patient safety. By implementing team coordination, team members can hold one another accountable for activities getting done correctly. And by communicating with the patient can begin to feel valued by their physician. Making sure that the patient fully understands their healthcare plan during a visit can also help improve the communication with the patient. A term called health literacy is defined as the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate healthcare decisions. It is unfortunate that only 36% of adults have basic healthcare literacy. Knowing consequences of unaddressed medical errors. Unaddressed medical errors can lead to adverse events that reflect the lack of patient safety. Medical holds exist in the form of fear. Providers do not wish to admit mistakes for fear of humiliation, thus patient safety remains in jeopardy. Medical malpractice suits are also consequences of unaddressed medical errors. By properly disclosing of the medical errors immediately, medical malpractice suits can be avoided. In conclusion, we should all healthcare professionals and patients together should ensure that they are fully understanding of errors that can occur, as well as how to properly promote patient safety. In doing this, the healthcare industry will once again be what it should be. Thank you.